Good morning. I'm Jody Wright, and I'm the Wright Midwife. Today we're going to talk about blood tests because when you're pregnant, one of the first things that happens when you go into care with any provider typically is that you'll get lab tests. And one of those is a complete blood count. And so I want to explain to you a little bit about that so that it's not, oh, blood tests, whatever, they know what they're looking at. It's important for you to understand that too. So a complete blood count is going to include information about your red cells, your white cells, and your platelets. Red cells are very important because they carry hemoglobin, and hemoglobin is a protein that picks up oxygen from your lungs and carries it to the rest of your body. So it is very, very important during pregnancy that you have adequate levels of hemoglobin because you need to get oxygen to both you and your baby. Because if you don't have enough, then you're told that you have anemia. And anemia just means that you don't have enough red blood cells, you don't have enough hemoglobin. And so your body isn't getting enough oxygen. So it's important to have high, levels that are adequate for that. And your provider, if you do have anemia, then your provider is going to recommend that you take an iron supplement. I don't recommend the iron pills at the store usually. Some of the best ones for anemia are Fluoridix, which is a liquid iron supplement, and it is extremely absorbable by the body. It's very, very good. There is another supplement called Energizing Iron that is in a capsule form, but it is also utilized very easily by the body, and it can help bring your iron levels up, your hemoglobin levels up. So that's very important. Anemia is also very important when we're talking about delivery, because if you have a low hemoglobin, low red blood cell count, and you have every woman loses a little bit of blood during delivery, but if you already don't have enough, and then you lose more blood on top of that, then you're talking about a higher risk for complications because your body is not able to recover and continue to oxygenate your body the way that it needs to. So even losing a small amount of blood can be very detrimental to someone who has anemia. The next thing that's going to be listed on your test is your white cell count. Now your white blood cells are it's what attacks the infection. So your white blood cells are, working against infection of any kind. So that's very important. And you would want to pay attention to that because if you do have some kind of an infection in your body, you can take care of it, hopefully before you go into labor or before it causes any complications for you and baby. The last thing that's going to be on the list is platelets. And platelets are part of the cell that helps to form clots. And this is important when you're talking about the bleeding, because if you don't have enough platelets, then your body is not going to be able to clot and stop the bleeding after the birth. So that's very important as well, and that would be something that needed to be corrected prior to delivery. So I hope that gives you a little bit more information about some of the testing that is done, especially in the very beginning of pregnancy, and explain a little bit as to why those things are important. And if you guys have questions, I'm happy to answer, and I don't want to get into too much detail. I'm just trying to give you guys the basics. But have a great day.